Hi, I'm Babette Edgar, and I am here today talking with Chris, and we're talking about the future of managed care pharmacy. How are you today?
I'm fine, Babette. Thank you very much.
So Chris, can you tell us a little bit about what you do?
Yes, I work for a drug company called MedImmune, which is part of AstraZeneca, and I'm unique in the characterization of most what you would call medical science liaisons in that I am focused entirely on the managed care space. So I support account managers for the clinical information that the company wants to provide to the health plan, unlike traditional KOL MSLs who are really talking to physicians and some of the big people at the academic centers who are doing the clinicals.
So I know you've been around managed care for a while, and a member of AMCP for a
Yeah.
while.
Yes.
And so you've seen a lot of change within the industry, and
Yes.
and no change is more evident than right now as things are rapidly evolving. So
Yes.
what we want to talk about today is just a little bit about what you think going forward the role of managed care pharmacy is going to be. We have Medicare and Medicaid changes. We have ACOs and patient-centered medical homes. So how do you see pharmacists fitting into those roles, and how's that going to evolve in the next 5 to 10 years?
When I look at the pharmacist role going forward, I really think that we're going to become more integrated as pharmacists and managed care pharmacists in particular with the total care of the patient. We're going to work closer with our nurse case managers and with nurses at the practices and the physicians at the practices. And I think that that's going to be an evolving thing, but it's definitely one of those things where we need to become involved, and that's why I think it's so important that we just recently had an amendment to our charter saying that healthcare practitioners can be full members in the AMCP.
Yes.
Full voting members, and I'm looking forward to seeing those people come to our meetings and engaging us and helping us traverse this sort of new way of doing business that we haven't really been doing before. There's going to be more emphasis on total care of the patient and population statistics than just like encounters, this encounter, that encounter. There's going to be more cooperation between the two of us so that we work as a team and we have a patient with a particular problem. The pharmacist will be responsible for one part of that problem, but we will communicate among ourselves to make that happen. And I see that's really going to be a big difference in the way we're doing it right now. Yeah.
And do you think that that's going to require specialized training in managed care? Because as you know, managed care has been considered a specialty, and now there's so many different things you can do within managed care. Do you think we're going to need specialized training in order to train our pharmacists to be Medicare pharmacists, Medicaid pharmacists, ACO pharmacists? What are your thoughts around that?
I think that as this evolves, it'll become clearer what we need as far as background and educational opportunities. Pharmacists come out of school really able to talk about any drug that's on the market, okay? But I don't think we are currently educating our pharmacy students to engage patients. And I think that's going to be a big difference. And I think we need, as an organization, to communicate that back to the pharmacy colleges. We're going to need people who have skills in talking to patients and behavioral change and working on teams. I was at a session at the PCMA where they were talking about the teams that they were creating, and one of the big issues that they have with these ACOs where pharmacists are involved or other people is that people have different personalities. So he said we need work on how do we develop teams and how do we know what is a good team and how to make that work. So I think there's going to have to be an evolution in that particular way as far as pharmacists go. And I think the idea of provider status for pharmacists is going to greatly change the way pharmacists interact with the healthcare team in general, and particularly with patients, because now the pharmacists will be given the opportunity to talk to a patient, to do some of the things that I think they've always been doing, and now they can bill for that and actually get paid as a recognition of their services. That's going to make a big difference. So I think that as we move toward provider status, as we move to more engagement in the teams, working with physicians and other healthcare workers, case managers, people within the outer community. We've sort of been in our little box trying to make things work. Now we're going to have to push ourselves out to become really working with them that we did not have to do before. I think it's just really exciting that this is going to happen. And people, for the first time, I think pharmacists are going to say, I'm really being seen as a part of the team. I'm really being part of what's going to happen. I'm really going to be doing this now, where before I was trying to just manage it.
Great.
Yeah.
Thank you so much for your time today.
Yes.
Been very, very helpful.
All right. Thank you very much, Babette. This was great.
You're welcome.
Okay.
You're welcome.